Well, it is important, especially with kids spending so much time online, that we get them outside to play and exercise. As we do that, though, in these winter months, we are going to take some time to talk about a winter weather risk, and that is frostbite. Dr. Kristen Bensick is a pediatrician with Children's Wisconsin. Doctor, good to see you again. I know winter-related injuries spiked just a bit these past few weeks with the snow and great conditions for kids to be outside. So let's first talk about what frostbite is and how you can tell it's happening or has happened to your child.
Sure. I mean, frostbite actually is freezing of the tissues, the skin and the tissues underneath, and it happens in, freezing temperatures. And so the first thing you'll notice that the kids complain that their hands are really cold, and then they might feel like some pins and needles, and then they can get numb. And then they actually sometimes can lose feeling, which is something that you really want to be concerned about. And so if you notice that, obviously we need our kids to keep warm. That's most important. But our kids live in Wisconsin. They like to be in shorts in weather like today.
Right.
And so it's really important that we watch what they're wearing and look for those signs when they're out for a long time playing.
Yeah, let's talk a little bit more about prevention of frostbite. The areas of focus, I imagine, are the extremities and just having those covered.
Absolutely. So it's really important. Put your kids in mittens. We all like to wear gloves because they like to build things, but actually your hands stay much warmer because they'll be together in mittens. Or make sure you have an extra pair of mittens if their gloves get soaked so you can change those out for them. And really, we've been kind of blessed this winter so far. It hasn't been super cold, but when we start getting into those really cold temperatures, make sure all your skin surfaces are covered. Put them in a face mask. Make sure they're really warm when they go outside.
We're talking with Dr. Bensick of Children's Wisconsin. So, doctor, let's say we are dealing with frostbite and you're pretty sure that's what it is. There are some real specific do's and don'ts in terms of treating it right away.
Right. I mean, so when the kids come in, it hurts when you start rewarming. So if it's a fingers or feet, you actually want to put it in warm water, not hot water, because they don't feel it at first. And if you put it in too hot, they actually could get a burn while you're trying to rewarm it. So just a nice warm water, stick whatever extremity part is in there for about 30 minutes and let it gradually rewarm. What you want to look for after that is you might notice some color changes. It can go from maybe white to blue to red. But if you ever see blisters after a frostbite, you really need to contact your doctor, because that actually is like a freeze burn of the skin and we treat it differently. Ibuprofen, things like that, Tylenol, ibuprofen for pain relief is perfectly fine.
And we'll top it off with a little hot chocolate too.
Absolutely, and a warm blanket and fire.
That's right. Dr. Bensick, thanks so much. Good to see you. She's a pediatrician at Children's Wisconsin. And if you'd like to connect with her or learn more about any of the things that we talked about today, you can check out the link that we created on our website. It's at tmj4.com/links.